Hello, Crystal Pellerin here. I'm a registered massage therapist located in Cochrane, Alberta. So I am talking about thoracic outlet syndrome today. It is a condition where the brachial plexus, located here and in the pecs, is a huge network of nerves, muscles, and blood vessels. And if the area becomes overused, strained, usually caused by work, it can increase in tone and it sits on top of the nerves or the blood vessels. Now when it comes to the blood vessels, it can be a little bit more serious. It can be an emergency, but that would show discoloration of the fingers, usually turning white or purple. Most common, it's usually just a compression of the nerves. Now you would feel numbness and tingling, like I said, pain as well. It's often confused with carpal tunnel syndrome. But carpal tunnel syndrome is usually pain in this area here, and there's tests to confirm if that's the case. Now, I do assessment to confirm which areas may be compressed. The three that are very common, and usually the issue, is the subclavius, so that's a muscle just above. It's actually on the inside of the clavicle here. The scalenes, there's three scalenes here. And then the pec minor, which is just underneath, basically beside the armpit. Now, depending on which one may be compressed, would cause the numbness and tingling in specific fingers. So what I'm doing today is I'm showing some exercises that will really help and ultimately cure the issue. Now, one thing to keep in mind, that posture is very important. So when we have our shoulders rounded and our head forward, it causes those muscles to be overloaded, and with a lot of the jobs that we do nowadays, it's forced us in that position. So keeping a correct posture is really important. Shoulders back, head back. Now the exercise I'm going to get into, first I'm going to start with the scaling muscles. So the scaling muscles, they do flexion, forward flexion, side flexion, and they also help us breathe. So they're attached to the ribs, so a lot of the time that's where you would feel the pain. It is a little deeper and it's hard to detect without doing the assessment. So the strengthening exercises for these would be flexion, side flexion, and front flexion. Now, it's super easy to do these exercises. For strengthening specifically, I would do every other day or at least 3 days a week. You're gonna do 3 sets of 10 or 2 sets of 15, either is fine. Now what you want to do is you're going to use your hand as resistance. You're going to put a little bit of resistance as you do forward flexion. So flexion, and you're going to repeat that 10 times. Okay, you're going to feel that burn after the 3rd or 4th rep. And then side flexion, same thing. You're going to use your hand, resistance, side flexion. Now I would recommend doing both sides, because a lot of the time what happens is it can start on one side and then it slowly develops into the other side because of the compensation. So those are the two for the pecs. The other is for the pec minor. Now the pec minor, it would show more so in the last 2 digits, the last 2 fingers, whereas the scalenes could be 1, 2, 3, these 3 fingers, or it could be the first 2. I've noticed that a lot of clients really do have the sensations a little different. The subclavius can also be these 3 fingers, but more so these 2. So that muscle's here. Now, when you're exercising, the location of the subclavius, it's hard to do strengthening on that. However, when you are doing the strengthening of the scalenes, it will really help. So combining them is the goal here. So to do the strengthening on the pec minor, so on a diagonal, if you can see them on a diagonal here, you can use a resistance band, you can use a dumbbell, you can even use a can of something. It doesn't have to be much weight. You want to do this, so it's abduction, okay? Sorry, adduction of the arm. And you're going to do the same thing, 10 reps, 3 sets or 2 sets of 15. You can feel that burn, and it is burning. You want to do that the same at least 3 times a week, every other day. You want to give the muscle time to recover. And then the stretches are key as well, because the tone of the muscle is increased because it's very tight. So you want to stretch it out. Now this would be daily, at least 2 times a day. So super easy. The scalenes, again, they do flexion, side flexion, front flexion. What you want to do is, so for the side, you want to do the opposite. So now we're stretching this side, the right side. You do flexion, you can actually feel it stretching, and it does stretch other muscles as well. So it'll really help, because a lot of the time with thoracic outlet syndrome, the neck muscles, the trapezius, levator, scapula, they're usually pretty tight as well. So 30 seconds, you want to hold 30 to 60 seconds, and you want to do this up to 2 to 3 times a day. And then the other one, so you want to drop your head back. So you're almost kind of doing a rotation and dropping your head back, and you can really feel the stretch here. And you just want to hold that position again, 30 to 60 seconds. For the pec muscle, to stretch that. So again, we're going into that diagonal position. Imagine there's a wall here, okay, because I want to show you the angle. So you're going to put your arm against, you're in a diagonal, and then you're looking away. As you look away and you're pulling away, you can really feel the stretch in the pec minor. So again, stretches you want to do 2 to 3 times a day. For the strengthening, you want to do at least 3 times a week, every other day, or 4 times if you're feeling ambitious. Over time, you'll really notice a huge difference, and that numbness and tingling should diminish. If you have any questions, please don't hesitate to contact me. Thank you.